Hey, Nurse Awesome. I know you guys are really a little bit antsy, excited, nervous about starting your semester. And so I wanted to make a video to see if I could just help you out with something that's going to be presenting itself to you fairly quickly when you start school. That's this concept of critical thinking skills. So your instructors are going to throw around that word a lot. They're going to use it as justification for theory questions and clinical situations. They're going to tell you that you need to learn how to critically think. They may also disguise this as thinking like a nurse, which of course you're not, right? Not yet. It was real frustrating for me because when I would miss a theory question, I would want to be explained why I missed it so that I wouldn't make that mistake in a patient situation or maybe miss that kind of question on the NCLEX. And what I got told a lot was that I needed to sharpen my critical thinking skills, or I needed to learn to think like a nurse. What I found out by the end of my first semester was really that for those experienced nurses that were my instructors, it really was like using common sense to them. It was easy. They had done it so many times, it was second nature. It wasn't that way for me or my classmates because we, of course, were not nurses. We didn't have all those years and years of experience. So really, critical thinking comes down to this. It's about gathering as much data as you can about your patient. Don't think that any piece of data is not important. So if you walk into the room, it's about assessing that situation. What's going on with your patient overall, what's their diagnosis, and what's going on with them at that particular moment. So in gathering data, you can look at their color. Are they interacting with you well? Are they breathing normally? Is there an IV running? What's the speed that the IV is running at? Is there a medication that's due? Are those medications compatible with one another? Something as simple as making sure that there's an ambu bag at the bedside is an example of critical thinking or thinking like a nurse. So if my primary objective as a nurse is to keep my patients safe at all times, and I walk into the room and I critically think, I'm going to notice whether or not there's an ambu bag in the room, whether or not there's an O2 connector, whether or not there's a suction setup ready. Because if something happens and those things are not in place, something worse could happen to my patient, right? And so this is what critical thinking is at its very heart. It's about gathering data, filtering that data about what's important now, and then determining with your skill set, your nursing knowledge, what should happen next. And if something happens next, what can you do about it? And then making a plan for that. So if I were to walk into a patient's room and there was no ambu bag, the very first thing that I'm going to do when I leave that room is go and get an ambu bag, because critical thinking tells me that if my patient stops breathing, I need to have an ambu bag to resuscitate them and to keep them safe, right? So all that seems like a very basic thing. If you can get in the habit when you walk into your patient's room of assessing the whole situation, the entire room first, not just the patient. Is the bed locked? Is the call bell where your patient can get to it? Are there belongings at the bedside? Is there a connector for the O2? What's the fluid running at? Those sorts of things will get you into the habit of looking at the situation with a critical eye. You're looking for those details that will help you determine what to do next to keep your patients safe. And that's really the name of the game, right? You want to keep your patients safe. So here's an example, just really simply. If I walk into my patient's room and I do a quick scan, or I'm gathering data from the entire room, and I notice that the fluid is running at 150 milliliters an hour, and I know that this patient is a chronic renal failure patient and they are on dialysis Monday, Wednesday, and Friday. Let's say that today is Tuesday. So in my shift alone, that patient, if I allow that IV to run at 150 milliliters an hour, it's going to take in like 1.5 liters of fluid that they're not going to be able to get rid of because they're a dialysis patient. Is that a safe situation for my patient? Thinking ahead or critically thinking. Could that cause some problems for my patient? What can I do to prevent those problems from happening? Well, obviously the first thing I can do is check the physician's order, because that may just be a very simple mistake that someone made when they programmed the machine. The second thing I can do, if by chance that is a valid physician's order, is call the doctor and ask them why that much fluid is running. And you don't do it in like an accusatory way, you just say, I need to be informed. Help me learn. I don't understand why. Doctors are very receptive to those sorts of things because their ultimate goal is to keep the patient safe too. So I guess what I'm really trying to let you know is that if you can just look at the entire situation as if you're fact-finding or gathering data, whether you're in a patient's room or you're on a test, gather all of the data, assess the scene, then filter the data with what you know is going on with that patient. Then start to ask yourself, what happens first? Obviously, some situations are more critical than others. What happens next? What can I do to make the patient safe? If you start to get in the habit of running those things through your head every time you read a test question and every time you walk into a patient's room, you're going to be developing those critical thinking, think like a nurse chops that your instructors think that you should have come into school with. And it'll make testing a lot easier. It'll make you a lot more comfortable and confident in clinical situations a lot more quickly. Anyway, I just wanted to share that with you because it really gave me some fits the first few weeks of school. I know that you're going to be a great success. I look forward to you telling me about it. Until next time, peace, y'all.